there are currently 3 Democrats running for governor of South Carolina, including healthcare and social justice advocate Gary Votour. I speak exclusively, Gary, for this edition of Quintin's Close-Ups. And if you haven't already, subscribe to my YouTube channel and like Quintin's Close-Ups on Facebook.
Gary Votour, welcome to the award-winning Quintin's Close-Ups.
Thanks. Pleasure to be here.
Oh, you're very welcome. I know that obviously you are a Democratic candidate for South Carolina governor, and you said that you're also a healthcare advocate and a progressive activist who stands for social justice. What is social justice in South Carolina today?
It's a complex issue. All right. One of the things that brought me into activism and away from my work as a healthcare advocate was Medicaid expansion, the lack of rural healthcare centers in South Carolina, the need to lower the cost of healthcare for everybody in our state. And those are things that I was standing for when I was working with the Poor People's Campaign for several years with Reverend Barber. What I realized was that in a state like ours, which, as Reverend Barber has said before, isn't actually red, it's blue. It's just been repressed and suppressed to the point where it seems to be red. We have got to figure out ways to give people a voice in government. And right now that's missing. And that's my biggest goal, is to do that.
Yes, sir. And let me ask you, how many rural healthcare centers that we need right now in South Carolina?
That depends on the nature of the centers. I mean, we have significant parts of our state that are less developed in terms of, housing density and things like that, and businesses, where people have to travel like an hour and a half just to get to an emergency room. It won't do us any good to expand Medicaid to cover 200,000 or 300,000 people if they have to travel an hour and a half just to get to an emergency room. We need to have rural healthcare centers, health stops, for example, that are product of a public-private partnership to put more facilities in rural areas where people can actually use their health insurance to get access to a primary care doctor or emergency services as they need it.
What public-private partnerships would you enact if you were governor?
If I was governor, I'd be meeting with Prisma and all of the other large healthcare providers in our state and offering them tax incentives to set up and establish healthcare centers in those communities that are underserved right off the top.
And let me talk to you about those tax incentives. What would be ideal for them?
Obviously, they want to make money. Healthcare is a for-profit industry. So things that lower their operating costs, like giving them an incentive in terms of a tax break on property taxes and income taxes from those properties, would make sense.
Yes,
for them and the state.
And I know that you, on your website, you said, I have a plan not only to expand Medicaid, but also lower the cost and improve the quality of health care for all South Carolinians. How would Medicaid expansion affect the state's budget?
Well, right now, under the Biden administration, Medicaid is free to expand for 2 years. They've created an incentive system that waives the usual 10% match. It's like when the Affordable Care Act, Obamacare, was first passed. There was a 2-year period where states that signed on to expand Medicaid under the ACA could get away with not paying the 10% state match. You got to remember that even without that, 90% of the cost of Medicaid expansion is covered by the federal government under the ACA. But they've also created some other incentives at the federal level that increase the reimbursement rates that we already get for people who are already on Medicaid if we expand. That money can be put in the bank and used to pay that 10% match for 2 to 3 years after the first 2 years. So we're looking at 4 to 5 years, if we expanded Medicaid tomorrow, before we'd actually have to bring it into the state budget. Beyond that, what's important to realize is that Medicaid is a federal-state partnership. I would anticipate, depending on the results of the next federal election, that incentives will still be there for more Medicaid expansion and offsetting the cost to the states. But there's another way we can actually do that ourselves. We can take Medicaid as an insurance option and actually put it on the exchange, the state exchange, as a private payer option. That would mean that you or I, if we weren't eligible for Medicaid and we were paying for our own health insurance, could actually purchase a Medicare product, a Medicaid product that would be comparable to the private insurance people are paying a lot of money for now. Because it would be run by the state and not by a for-profit industry, the cost would be lower, and we could engineer the cost of that to cover the additional costs that would be incurred by expanding Medicaid for 200,000 people.
Now, going back to Medicaid expansion and obviously it affecting the state's budget, what net savings would there be for South Carolina?
Say that again. Sorry, trash truck just went by.
No worries. Going back to the Medicaid expansion and how it may or may not affect the state's budget, what net savings would there be for the state of South Carolina?
Well, right now we've got 170,000 people that don't have health insurance that would immediately become eligible. These are people that make too little to get a subsidy from the federal government to purchase an insurance policy that they can't afford anyway. And because we haven't expanded, they're not eligible for that. Add on to that another 140,000 people or so who are paying a significant amount of their income to have health insurance, who would then become eligible and would theoretically, at least most practically, yes, move to Medicaid as their insurer. That brings 300,000 people into the Medicaid rolls. Giving people health insurance should be a right. It really should, because it's not just the life, liberty, and the pursuit of happiness that we're talking about. It's also the cost of health care for everybody else. When somebody who doesn't have any insurance or Medicaid breaks their leg, they go to the emergency room. They can't afford to pay their bills. The hospital isn't able to collect that money, correct? So what happens is they end up billing that money off. Some of it used to come from what's called the uncompensated care pool. But that's been dissolved because they felt like, well, everybody's going to be eligible for Medicaid. The ACA did that. That cost of that uncompensated care is passed back on to everybody who uses the healthcare system. And when the healthcare costs go up, health insurance rates go up. So by expanding Medicaid, we actually save everybody money on their health insurance rates. We make the marketplace more competitive. That would bring down the cost of health insurance. Right now, there's kind of a monopoly in South Carolina and in a lot of states where there's only one or two health insurance providers in the state exchanges that people can purchase, and that includes employers. Employers would also be able to purchase Medicaid as a health insurance option for their employees at a lower cost than what they're paying for private sector insurance.
Well, what net savings would there be for the state?
Significant. I don't know what the numbers are because it would depend on how many people actually enroll. It would depend on whether or not HHS, the federal government, allows us to put Medicaid on the exchange as a public option. There's absolutely no reason they shouldn't. I would just have to direct the DHCC to apply for it and go through the permitting process with the feds to get that done. And then we'd actually have a better estimate of what the net savings would be. But I don't see it as being something that costs money in the long term. I really believe that we can expand Medicaid for 300,000 people to 300,000 people in our state, improve rural health care access, lower the cost of health insurance without touching the tax rate for the average South Carolinian.
What is the average tax rate for the average South Carolinian?
I don't know off the top of my head. It varies widely depending on what your income level is. It's significant. It's a lot lower than in some other states.
How much has the federal government paid as far as the cost of expansion coverage, say, from 2014 to 2016?
In South Carolina?
Yes,
nothing,
sir.
Because we didn't expand.
How much did the federal share drop by?
Well, right now we get about 55 to 60% of the federal government pays for Medicaid for people who are eligible. That includes people who are elderly and extremely poor, people who have no pregnant women. A significant number of the people who are on Medicaid are actually children of parents who don't have a lot of income. So we're paying a significant amount of the state's money to cover those people. It's called a safety net for a reason. As Desmond Tutu once said, we have to go upstream and stop pulling people out of the river that are drowning and go upstream and figure out why they're falling in. And that's what Medicaid expansion does.
Now, let me ask you, what percentage was it settled as far as the Medicaid expansion for fiscal year 2020?
It was, I think, about 20% of the state's budget.
How much would South Carolina have to pay for the remaining share?
Well, it's misleading to even say it's 20% because that number is before the federal government actually gives them back the reimbursements. So about 60% of that was actually reimbursed.
And what were the hospital's uncompensated care costs in 2020?
I don't know that number off the top of my head.
What were South Carolina payments to hospitals to help cover those costs?
What do you mean?
The South Carolina payments to the hospitals for those costs, uncompensated care costs.
Significant because South Carolina doesn't pay it directly. The marketplace does. And it's a nebulous thing, but it's an acknowledged thing. There's multiple studies that pin those numbers at very different levels depending on who's doing the study. But you're talking about millions of dollars in uncompensated care goes out in this state to people that should be eligible for Medicaid. And the state doesn't pay those costs. We pay those costs. I'd also point out that Medicaid expansion is already being paid for out of our federal taxes. That money is already being taken from South Carolinians by the federal government and should be used to expand Medicaid.
How much did the state spend on programs for people with mental health or behavioral health needs?
Not enough. One of the things that Medicaid does do is give people mental health providers that can actually improve their life beyond just physical care. It's preventive care. If you've got people with diabetes that aren't getting the treatment that they need, it's long-term care. If you've got somebody who may have cancer and not know it, and you can detect it sooner, you can actually not just save their life, but reduce the cost of care over time. It's a complex issue, but ultimately the solution keeps coming back to giving more people, especially lower-income people who can't afford it, access to health care.
What is the current enrollment for Medicaid?
In South Carolina?
Just in general.
Enrollment in what way?
At Medicaid, what's the current enrollment?
It's a large number, and it varies from state to state because we've got 12 states that haven't expanded Medicaid, including South Carolina.
Yeah. How much of that enrollment, Gary, would generate revenue gains that further offset those expansion costs?
It wouldn't necessarily be a revenue gain, but it would be enough to offset the cost. What I'm talking about is if we were to put Medicaid on the exchanges of private insurance, we'd actually have to figure out how much we're going to charge people for that so that we could offset the costs. I know that the numbers are there to significantly either reduce or eliminate completely the cost of expanding Medicaid if we were to make it a public exchange option.
How would Medicaid expansion improve coverage rates?
Say again?
How would Medicaid expansion improve coverage rates?
Coverage rates? Well, we'd be adding 250,000 people to Medicaid. That's a significant number of people. It would take us, I think we're at 12% right now of people in South Carolina that don't have insurance. In states that have expanded Medicaid, that number's dropped as low as 2 or 3%.
Let me turn over to the minimum wage. You also said this. I also stand for increasing the minimum wage to $15 an hour for everyone, ensuring equal rights for everyone, legalizing marijuana for everyone. I'm going to get to that in a second, and criminal justice reforms that benefit everyone. But let me ask you this, Gary. A $15 minimum wage would give African Americans and Latinas in South Carolina what percentage of a wage increase?
Significant. I mean, right now, the minimum wage in South Carolina is the federal minimum wage of $7.25 an hour. It would literally double the wage that people make at the lowest levels of income earners in our state just to move it up to 15. I use 15 as a number. It's not necessarily a hard and fast number, but it's a minimum that I would want to see as a governor. A living wage is literally what lets people live. Right now, when you look at the cost of living in different parts of the state, there's parts of the states where they estimate $17 to $18 an hour if you work a 40-hour-a-week job to afford an apartment and cover the cost of living. We have fallen way behind. A lot of states have adopted their own minimum wage. The federal government is still embroiled in a discussion about what the minimum wage should be, and that's gone on for far too long. It's time for South Carolina to take the initiative and do this for themselves. I mean, to me, it's imperative that we let people earn a living wage. I know too many people who work several part-time jobs just trying to make ends meet. And they're working 20, 30, 40, 50, 60 hours a week, and they're still falling behind. And it's not right. There are people who are making millions and millions of dollars off of their labor because they're not paying them what they deserve to make. And what I'm saying is that we need to level that playing field and raise it now. We also need to have cost of living increases every year that keeps up with the cost of living and inflation to that minimum wage.
Raising the minimum wage would increase economic activity and spur job growth where in South Carolina?
Across the board, in my opinion, it would make more competition, for one thing. Right now, what we're seeing is Governor McMaster is just bragging the other day about the lowest unemployment rate in history in South Carolina. I think he said 3.7%. But when we go to Wendy's or McDonald's, how many of those have signs up saying now hiring in big, huge letters? How many of them can't afford to have staff that actually opens their lobbies? Everybody's running on an assumption that everything's great because, state government says it's great, but it's not. All right. These are businesses that are hurting. The reason they're hurting is because during the pandemic, people upgraded their jobs. They took the opportunity while they had unemployment benefits because of the pandemic to find better jobs. And now we can't find people to fill the low-paying jobs that were traditionally filled by lower-income people. And raising the minimum wage makes those jobs more competitive. We can't expect employers to do this for themselves because asking, if McDonald's was to raise to $15 an hour, but Burger King didn't, Burger King would have an unfair market advantage. They wouldn't have a cost that they need to pass on. Right? And one of my arguments about this is that, especially in the fast food industry, is if McDonald's can afford to give us free fries on Friday by using their app, they can afford to pay their people a better wage.
Who has the market advantage right now in South Carolina?
Market advantage in what sense?
In the job, as you mentioned, the job market.
Professionals.
What professionals?
White collar.
Where?
Mostly in the cities. Definitely not in the rural parts of our state. That's where we need to actually make improvements. One of the things I'm also in favor of is allowing unions. We are a right-to-work state, quote unquote, and that's a misnomer. We don't have a right to work because a right to work would include the right to actually form a union if your employees want to do that and use collective bargaining to improve their position within the company. We basically outlaw unions from being created. I'm a big advocate of that. My lieutenant governor candidate, Harold Gettings, he is an AFL delegate, AFL-CIO delegate. He's also a union sheet metal worker. And he still has to drive for Uber Eats in the evenings to make ends meet.
And I hope to get Governor McMaster on Quintin's close-up soon. I've been trying for so many months and probably 2 years with his press secretary, Brian Sims, but Brian keeps ignoring me. So hopefully I'll get Mr. McMaster on Quintin's close-up soon. But let me ask you, where in South Carolina, Gary, by increasing the minimum wage, would reduce poverty?
Everywhere. Right now, in terms of industries or geographically?
Oh, yeah, you can talk about geographically.
Sure.
Yes, sir.
I think it would reduce poverty everywhere. We have a significant problem. South Carolina consistently ranks in the lowest rates or the highest rates of poverty in the country. And one of the biggest reasons for that is our low wages. We attract businesses that create what I call crap jobs, where they don't pay good money. One of the things that Governor, I recognize, before we get too far into this, I have to say, I recognize that if I'm elected, I'm still probably going to have a General Assembly that's not going to agree with me. But there are things that, as a governor, I can do to make this happen. All right. One of those is to stop giving tax breaks to large employers that want to come to our state unless they pay a living wage, provide full-time jobs, not part-time jobs, with benefits, and include things like employer-funded health insurance. We hand those out to companies like Boeing to just get the job numbers up. but they don't necessarily create good jobs. They'll say that they create some good jobs, but most of those are people who come from out of state for those good jobs, and then the factory workers are left with substandard pay and poor benefits.
Yes, sir. What manufacturers are the biggest three biggest employers in the state of South Carolina?
The healthcare industry, the aerospace industry, and the defense industry.
Now, let me ask you this.
The food industry, the restaurant industry, the tourism industry, they're all big.
Now, how many people in South Carolina are actually unemployed today?
I think that Governor McMaster said just a couple of days ago, 3.7%. Now that's number is I'm going to guess that that's a very biased number because he said it, to be honest with you. It probably includes part-time employees. Excuse me. And not necessarily all full-time employees.
What area, Gary, has the most unemployed residents in South Carolina?
The most unemployed, probably
Yes,
the fast food industry.
okay. Now, how many people in the state of South Carolina have actually turned down jobs due to unemployment benefits?
I don't know of any. I mean, there were people who worked in high COVID risk jobs. And because of the pandemic, they were able to, when their businesses closed, let's say you worked at the local restaurant and it shut down or scaled back operations and they laid you off. Those are the people that collected unemployment. And as the businesses reopened, they went back to work. Governor McMaster continues to create this narrative that somehow unemployment benefits only benefits lazy people. You know, when he cut off the federal benefits several months sooner than they needed to be, that were being given to people who were pandemic unemployed, he basically said it's time for them to get back to work. Like it somehow wasn't it was their choice not to work because they were making so much money on unemployment. But that's not a true narrative. It's a narrative that's created by the right to justify their policies that basically benefit businesses and put profits over people.
What policies would you enact for these businesses?
Which businesses?
You just mentioned businesses. What policies would you enact for the businesses to make sure they're staying in business?
Well, we're a capitalist country. If your business is viable, you're going to stay in business. I don't feel like we did enough during the pandemic. I've been a vocal critic of Governor McMaster throughout the entire pandemic. I've been running for 2 years. I anticipated running a different campaign than what I've been able to run so far, but the pandemic kind of put a halt to that. I feel like we didn't respond well, and people died needlessly because of that. I think we're at 14,000 dead in South Carolina. Just yesterday, I think we had something like 560 more people become a 6.6% COVID positive rate. The next wave that's coming into us, they're calling this the winter blizzard of COVID, the Omicron wave. All right, we're still not prepared for it. The lack of mask mandates or even a vaccine passport system has encouraged a cult-like following of freedom lovers that think that they should not have to wear a mask or get a vaccine to protect other people. And the Governor McMaster encourages that by his inaction and his partial truths. Right now, the Attorney General of our state, Alan Wilson, and Governor McMaster are working together to fight the vaccine mandates that would be coming through OSHA. Alan Wilson announced the other day that even though the circuit court, the federal court, overturned the injunction against the OSHA mandates requiring large employers to have vaccination requirements for their employees, and it's not a mandate. It's not saying you have to just have that. It's saying either get vaccinated or get tested. We can wear a mask. They leave that part out. All right. So now we've got a federal court of appeals on a 2-to-1 vote decided that the mandate stands. But of course, Alan Wilson and Governor McMaster decided to take this to the Supreme Court and appeal that decision all the way up the chain to the federal level. It's an amazing amount of money that the leaders of our government continue to spend fighting things in court that aren't constitutional, like abortion bans.
Let me stay on track, Gary, and let me get back to what you said earlier. You said the governor told partial truths about COVID. What were those other partial truths that need to be told rightly?
That people need to get vaccinated. People need to wear masks in indoor public spaces. It's not about your personal freedoms. A mask is just a piece of paper on your face. I've said this before, and I'll say it again. Nobody's asking you to storm the beaches of Normandy. You know, it's a small infringement on your personal space to put a mask on, number one. Number two, vaccines are safe. They're effective. It doesn't necessarily keep you from getting sick. But when we look at the people who are being hospitalized now for COVID, 95% of them are people who weren't vaccinated. And that should be enough of an incentive for everybody to get vaccinated. But Governor McMaster saying it's a question of personal freedom whether or not you get vaccinated is not telling a truth. It's a half truth. I mean, he's good at layering this stuff in a way that lets the people that don't want to get a vaccine believe he's telling them don't get a vaccine without him actually saying it. And that's what I mean by half truths and misinformation. But I'll point out, when Governor McMaster and his wife caught COVID over a year ago, they got vaccinated shortly thereafter, as soon as vaccines became available. They got antibody treatments immediately that most people without health insurance couldn't afford. They took care of themselves, but he doesn't talk about that. Okay? It's leftovers from the 4 years of Donald Trump, you know, that has created these political divisions in our country and in our state in particular that are hurting people still. And I'm ready to fight against that.
What current data, Gary, do you have on natural immunity?
You mean after you've had COVID?
Yes, sir.
All right. I've had COVID. I had COVID a year and a half ago. When I was still working as a healthcare advocate, I picked it up within the first few months of the pandemic. As soon as vaccines became available, I got vaccinated. As soon as I could get boosted, I got boosted. Because I also recognize that having had COVID is not preventive of getting COVID again, especially with new variants coming on. Immunity isn't permanent. I can't say that often enough or loud enough. Again, it's not permanent. It's a time-based effect. Your antibody levels decrease over time after you've had COVID. The thing is, you can have a high level of antibodies. You can get COVID. You can be non-symptomatic and not even know you have COVID and give it to other people. This is why it's so important that we start protecting each other. There are people who can't get a vaccine, people who are immunosuppressed or too young or too old in some cases to take the vaccine. We need to protect everybody by doing what's right. And what's right is getting vaccinated, getting boosted, wearing masks in indoor public spaces, or when you can't avoid direct contact with people, regular testing. I do campaign events, and a lot of times I'll be in a group of people that are vaccinated for the most part, and masks will come off. And I recognize that. I tend to keep my mask on, but I also go in, if my event is on a Saturday, I wait until Wednesday and I head over to DHEC and I get another COVID test to make sure that I haven't picked it up and I'm inadvertently spreading it. And I've been sick with it, vaccinated, boosted. I don't want to take the risk of making somebody else sick and killing them. Every single person who gets COVID, every single person who dies of COVID caught it from someone else. It didn't spontaneously happen. And we need to own that and take responsibility for that as a society.
And would washing your hands and keeping your immune system clean and exercising help as well?
Sure. It doesn't hurt. I mean, we don't think that I stopped washing my groceries when I brought them home a year ago. It doesn't seem like the COVID virus lasts long on hard surfaces like they first thought it might.
Right.
But contact surfaces, like I just coughed on my hand. If I walked into a public building and touched the door handle and I've still got active COVID on my fingertips, the next person that touches that door handle could pick it up. And that's where hand sanitizing works and hand washing. Masks, if I was out in public and with my cough right now, and I had a mask on, I wouldn't be potentially spreading the source of that cough, which isn't COVID, just so you know. I just have a chest cold.
How many state residents have been vaccinated?
Hmm?
How many residents in South Carolina have been vaccinated?
I believe we're at 61% of South Carolina has gotten at least one dose, but we're just at about 50% or so that have gotten 2 doses, and even lower on the boosters.
How many of the state residents are actually unvaccinated?
40%.
How many have been tested?
Probably a lot more. DHEC has cut back on testing facilities across the state as they shifted to pushing vaccines instead. I think that was a mistake. I think that we need more testing facilities. We need home testing kits available. We're still falling way behind on a lot of issues that we need in order to get ahead of this. Make it clear that what we've conceived of as a pandemic for the last 2 years is now becoming what's called an endemic, meaning that it's not going to go away. Because in developing nations of our world, only about less than 1% of the people have been vaccinated. There aren't enough vaccines to vaccinate the entire world. There are continually going to be mutations of the virus that are going to be not as respectful of our vaccination status as we might like. Omicron seems to be one of those variations. It seems to still infect people who are vaccinated. But if you're vaccinated, you're probably not going to end up in the hospital dying of it, because you've got an immune system that's been triggered to fight it before you get it.
I know we were on the topic of minimum wage before you verged off the COVID, but let me get back to the minimum wage. Raising the minimum wage to 15% would increase child care costs in South Carolina by an average of what percent?
Don't know. I'm going to be honest.
Yeah, okay. Well, raising the minimum wage would harm what course areas of the South Carolina area?
I don't think it would harm any areas, to be honest with you. It may take a percentage of the jobs off the market for businesses that can't afford to stay open, but I'm not so sure that that's the case. In states where the minimum wage is twice what it is here, they still have as many jobs for people as we do. The statistics don't bear fruit to the argument that increasing the minimum wage decreases the number of jobs. And even if it did, if your wage doubles for your primary job, then maybe you don't need that part-time job anymore just to make ends meet. So maybe it's time for some of those lower level part-time jobs to disappear.
Now, if that were to decrease, how many jobs would be, part-time jobs would be eliminated?
I have no idea. I can't just make up numbers. I won't do that. In states where this has been enacted, where we've got decent minimum wages, the number of jobs available don't significantly go down. And I don't think they would in South Carolina either.
You said this on your website, Gary, quote, I also have a plan to eliminate property taxes for the poor, disabled, and elderly that actually increases funding for all of our schools without raising taxes for the average South Carolinian. But wouldn't this increase taxes on the middle class while missing the chance to adequately fund schools for middle and low income families?
I'd be happy to explain that. Right now we have a process called abatement, which lets anybody walk in and get an abatement for their property taxes, but only very few people in our state can do that. Veterans can do that, lower income people, veterans basically, and a few other small, very narrow segments of our population. What I'm proposing is that we expand those abatements to include people who are at poverty level or below for income, people who are over 65 and on a very fixed income, and people who are disabled and living off of a Social Security disability check. This would increase home ownership in those classes. Those are the groups of people that are most likely to be foreclosed and are drowning in debt, basically. And what we need to realize is that property taxes go to county governments. Okay, they fund county governments. County governments fund schools. Okay, so if we're going to do A, we have to do B. And what B is a school tax. And I keep saying, nothing I say, nothing I propose will raise the taxes for average South Carolinians in our state. But a school tax would have to come along with the abatement increases, and that would be levied against the top 5 to 7% income earners in our state. People who are making millions of dollars a year in income should probably pay a little bit more in taxes. That would go into a fund that would then be dispersed directly into the school system and replace those county funds that we lose with the property tax abatement. If we were funding the schools directly, then the state has the choice, and I would fight for this to the death, basically, to fund schools that are in impoverished counties better than schools that aren't. That would help us reduce the impact of places like the Corridor of Shame, where schools are chronically underfunded because they're in rural communities that don't have a lot of property taxes. It would let us balance the scale, basically, on schools. It would let us increase the funding for schools, pay teachers a decent wage so that they're not dissatisfied. We've lost thousands and thousands of teachers in the last few years because we didn't pay them enough. We keep promising them raises, but those raises never come. They're dissatisfied, and we need to fix that at the same time. So I see that coupling the two things together is a win-win for everybody. And honestly, it's time for that top 5 to 7% of wage earners to pay their fair share. There comes a point, if you're making $1 million, $2 million a year in income, what are you going to do with all that money? Some people give it altruistically. I get that. A lot of people don't. They just invest it. They make more money off of it. But almost nobody works a job where they make $100,000 an hour that they've actually earned that $1 million a year. They're earning it off the work and labor of people who work for them, businesses they invest in. And they need to give that back to the community and invest it directly into the next generation of people that need a better education. Better education is the key to a more viable and just society.
And I'm going to get back to that in a second, but what is the typical property tax in Hampton County?
I don't know off the top of my head by county.
Would you then, Gary, increase the personal income tax?
For the top 5 to 7% of earners, I would definitely be willing to consider an income tax increase, a capital gains in tax increase, an estate tax increase.
As a matter of fact, how could you increase the state income tax?
That would require an act of legislation, just like a property tax abatement would. It's going to require a General Assembly that agrees with me, which brings me to an important point.
Okay.
I don't anticipate that being the case when I take office. In fact, I'm pretty sure it's going to be quite the opposite. However, for the first 2 years I'm in office, I'm going to continue to fight for these things. I'm going to continue to propose them very loudly. And I'm going to show people that a person without a large political background who's not a politician can actually become elected to lead something. In this case, South Carolina. And hopefully that will encourage a lot of people to run for those General Assembly seats in their districts. And B, will change. In 2 years, there'll be a midterm. Well, every seat in the General Assembly comes up for a vote. And maybe the second 2 years that I'm governor, I'll have a General Assembly that will work with me to actually get these things accomplished. But I'm going to make sure that everybody knows the current situation, the people in the General Assembly are not working for the constituents that voted for them. They're working for themselves.
Households with incomes, for instance, between $40,000 and $63,000 would see an annual tax increase of what?
That's middle income, no tax increase.
If there is a large increase in taxes, what schools will receive new revenue?
Well, the increase in taxes would be on the top wage earners, that top 5 to 7%. Those would be, first of all, we'd have to replace every penny that the counties lose from the property tax abatement. We'd have to figure out a number on that percentage increase and who gets that increase that is sufficient to do that and create a surplus. And then that surplus would be used to supplement the school budgets in the school districts that are underperforming, where the quality of the education isn't as good, that the schools need improvements.
What would okay? Would wealthier districts in the state that choose to raise their property taxes to benefit their schools would now see their property taxes disappear?
They wouldn't see them disappear. We're only talking about people who are at poverty level. So if they're a wealthier district, they won't have as many people, will they? They will lose. They lose property taxes from people who are at or below poverty level, people who are disabled, and people who are elderly on a fixed income. This isn't the abolition of property taxes. Your average person would still pay their property taxes, the average earners.
Do you believe the higher cost of their education would spread among all state taxpayers through sales and income taxes?
Income taxes are tricky. I mean, all too often we pass things in our state that are supposed to help everybody under. I'm more of a targeted tax and spend approach. And that's what this is. It is a shift in tax burdens from people that can't afford to own homes to people that are making millions of dollars, and then spending that to improve things where it's the most needed within our school system.
Let me turn to legalizing marijuana, that is. Why must we legalize marijuana if there are legal alternatives?
Well, there aren't. The federal government still says marijuana is illegal. People are disproportionately jailed in our state based on color for simple possession. I mean, a large percentage of the people that are in our jail system now, in our prison system, are there for something that most people wouldn't see as a problem. They're disproportionately convicted because they can't afford decent lawyers. So it's poor people, it's people of color that are being basically arrested, prosecuted, and sentenced to jail for something that most people don't feel like should be illegal in the first place. I'm in favor of legalizing marijuana and, to a degree, privatizing it, allowing red dot stores to spring up around the state. But I'm also in favor of allowing people to grow and consume their own marijuana, and helping small businesses like minority-owned farms create a new cash crop that benefits everybody.
Could someone walk into a local corner store, Gary, and buy it, or will there be specific state-regulated facilities that can actually sell that plant?
I think that we need to actually have a plan as to how we're going to implement legalized marijuana. And that would be a part of that process, is to figure out what makes the most sense. We're going to have to collect taxes on sales of marijuana. There's no question about that. How we do that would be up to legislation.
Let me jump right into that. Okay.
Yeah.
How would cannabis products be subject to the state sales tax, that is?
The same way alcohol and tobacco is. By a licensing authority that issues a license, a tax stamp on each package. When you look at a package of cigarettes, there's a little stamp on the bottom. It says the taxes were paid for this product. The same with alcohol. We regulate the sale of alcohol and tobacco in a very efficient way, I believe, that creates a revenue stream for the state. We can do the same thing with marijuana.
Could a municipality, that is, pass a local ordinance to charge a local tax on cannabis products?
I guess they could. I don't know if they would, but in theory they could. I don't think local municipalities have passed alcohol or cigarette taxes.
Would revenues from marijuana be used to reimburse, say, local police departments for training officers to recognize impairment of marijuana?
I think that would be a really good use of it. I would say that, marijuana needs to be subject to the same rules of use as alcohol is. No driving while impaired, et cetera, et cetera, et cetera. No selling or distribution to minors. The rules already exist. We're just basically adding another drug. Alcohol is a drug just like marijuana is. We've managed to efficiently train officers to recognize when somebody's drunk. I think we could probably train them to recognize when somebody is high. I think that a lot of them do that now. They know how to detect the smell of marijuana on people and the signs that somebody's intoxicated with marijuana and alcohol.
Now, would this allow South Carolina to derive revenues from the basic 6% sales tax that actually applies to all goods, Gary?
Sure, of course it would.
Would you, as governor, allow municipalities to charge an extra 2% tax?
If it was justifiable, I don't. It really wouldn't be up to me as governor to determine that. Like we've talked before about the powers of the governor are extremely limited in this state. My proposal is that I'm going to use every single power that I can get my hands on to make changes for the good of everybody. Period. If this community wants to charge 2% extra on a sales tax to invest back in their infrastructure because the state isn't giving them enough money, then we need to look at why the state isn't giving them enough money in the first place.
Won't legalization, that is, make marijuana more available for children, adolescents, and young adults?
I don't think so. I think it's plenty available right now. Just go to your local parking lot and spend an hour there and watch. And you'll see that marijuana is being freely sold and distributed in our state at all levels. And actually, I think it would make it less available because what it does is it takes out that middle layer of people that don't have any rules or constraints on who they sell it to.
How would the prosecution of an illegal sale of or purchase of marijuana change?
It would be just like alcohol.
How do you think most people in South Carolina will prosecute or identify people who drive under the influence of marijuana?
How?
Yes, sir.
Well, there are drug tests for it, just like there are tests for alcohol. Granted, it's not a breathalyzer test, but there's signs that somebody is inebriated or impaired. That's
Yes.
what law enforcement is for, is to decide whether or not somebody needs to be brought in with suspected use, have a blood test, released, and then held accountable if they were. I do believe there are some fairly rapid blood tests available for marijuana. Employers do it all the time, and they get results back in 24 hours from testing facilities.
Well, let me turn over to some other issues. Let me
Sure.
ask you this. How many people moved to South Carolina over the past year?
We had an increase. I know that. Not really sure because the census numbers are kind of skewed. We didn't do really great with our census count this year, in 2019. There were a lot of reasons for that, most notably the federal government under Trump didn't emphasize the census the way it should have. So I think actually what we saw in terms of an increase is probably an undercount, at least amongst minority and alternative populations. But we also have a significant number of seasonal people who come here, all right? People that work fields, et cetera, et cetera. Those were definitely undercounted. We had a significant number of increase in people, but the numbers that we're seeing right now as the census data becomes available, which is just starting to happen, is an increase in retirees and middle income professionals because they were more likely to actually be censused, for lack of a better word. They were more likely to actually be counted.
Now how many residents has South Carolina lost in 2020?
I don't think we lost any residences in 2020.
Yeah, okay, well, let me ask you this. How many foreign businesses in the state have created full-time jobs?
Not as many as there should be. I don't have those numbers sitting in front of me. I'm not a statistician. I think that we probably have seen a net decrease in full-time jobs and a shift to part-time employment because part-time employment doesn't require you to give benefits to people.
Did these particular businesses provide employer-funded insurance to its employees?
Only if they're full-time right now.
What tax incentives, Gary, would you have for solar wind generators?
As many as possible. I really believe that the future of our country, our nation, our world is investing in green technologies. If somebody wants to start a wind farm or establish a solar energy facility, I think that they should be able to do that almost tax-free for at least several years and make as much money as possible doing that and bring the cost of doing that reachable and more affordable for small businesses, especially minority businesses. We have a lot of farms in South Carolina that are minority owned that I would love to see them being able to take those fallow fields that they can't find a crop that's worth raising and turn them into solar and wind farms and give them as many possible incentives.
Now, let me turn back to the income. What is the per capita income in the state of South Carolina?
I don't know that off the top of my head.
Currently, what is the per capita consumption in the state?
Don't know that off the top of my head.
Already? How many people in South Carolina live below the poverty line, Gary?
I believe it's around 14%. We're waiting to see the 2020 census data. That is just now becoming available. I just got a set of data last week that I haven't even had time to look at yet that has more accurate income. I don't like to throw numbers out and be wrong.
Oh, no worries. You know, as a journalist, I have to ask those questions. Let me ask you this. What are demographics in the state of South Carolina?
What are the demographics?
Yes, sir.
About a third of our state are people who are not white. They aren't represented accurately in our government. One of the things I've talked about is that as governor, I'm entitled to make a lot of political appointees, cabinet heads. I'm able to shift employment practices within state agencies. And one of my goals would be to actually make sure that that is proportionate to the racial composition of South Carolina. In fact, I would say that if you go with a third of our state is black, then I think that half of the people that I appoint to cabinet positions should be black, not just a third, because we need to balance the scale back a little bit. There's plenty of qualified people to fill every position that a governor gets to appoint. My perspective is it's time to give representation back to the people who haven't been represented well enough in the past and tip the scale a little bit.
How much, as far as the minority population, particularly African American residents, have decreased?
I don't think it's decreased. I think we've had an influx of white people, but again, because the 2020 census was flawed, we'd have to go back to like 1990 and then a whole bunch of informal censuses. I'm waiting until I see the full data from 2020. Right now, we only have partial data. It's like metadata that is not in-depth, detailed breakdowns. The Census Department is busily trying to fill the gaps and make estimates of what was undercounted and adjust the data accordingly. And we'll see that more and more in the next couple of months.
How many infrastructure projects have been completed in South Carolina over the past 4 years?
Get those crickets. Ones that are actually important, or do you mean at the small scale or the state level?
Oh, the state level, yes, sir.
Yeah. Again, crickets. I don't think that we have plenty of infrastructure projects that are going on. I mean, Governor McMaster is proudly saying, I'm going to spend pandemic money to get this corridor finished and this corridor. But those things could be done now. I mean, we got to talk about a larger picture of what kinds of infrastructure we want to develop in our state. We spend a lot of money widening highways. All right. I want to see us actually realistically talk about things like a light rail commuter option that links the three cities of South Carolina quickly and efficiently in a way that doesn't increase the carbon footprint of our state. Increasing the roads actually just puts more cars on the roads, and cars are one of the biggest contributors to global warming that we have in our state. It's almost like we're shooting ourselves in the foot every time we do this. We've talked a lot about things like gas taxes. We subsidize fossil fuels in our state. We have one of the lowest gas taxes in the country. It may be time to think about changing that and actually bringing the gas prices up a little bit in order to encourage people to look at commuter options and use their vehicles less often and rely on things like public transportation in order to reduce the carbon footprint of South Carolina, as well as investing in green energy. That would definitely be on the table if I was governor. I really am a firm advocate of rail access. When I was a regional planner back in the 90s, I helped develop a commuter rail option that linked two cities in Massachusetts between Worcester and Boston. We renovated an old train station and made it a commuter hub and established a high-speed rail system that linked the central city of Worcester into Boston, which was the capital city. And that ended up reducing the number of vehicles going back and forth every day significantly. And you get your time back when you're sitting on a train for an hour instead of in traffic for 2 hours. So it made more people more productive.
Yes. Yeah. And I gotta wrap. Yeah, and I gotta wrap this. Yeah.
Investment we should be making.
Yeah.
Right now, we just keep playing catch up.
Yes, sir. And I
widening roads and filling potholes, but we're not doing a really great job of it because, things are money's tight, and it's a political process where that money gets spent.
Okay.
And we need to reduce that.
Yeah, I have to wrap it up really quickly, but what is the carbon imprint here in South Carolina? Footprint, that is, excuse me.
It's significant. It's not as good as it is in other states. There is no qualitative measure of what a carbon footprint per person is that is statistically comparable to other states. But ours is higher than a lot of other states because it's the South, and we rely on our cars a lot more because of the heat.
Now, how much of the gas tax is actually being used on infrastructure here in South Carolina?
On paper, in reality, on paper, it's probably all of it. I'm pretty sure that's what it's supposed to be used for. But you could just as easily ask how much of a lottery ticket sales actually goes to a school. Not much.
Now, should the state of South Carolina make internet a utility, Gary?
Yes. Everybody should have equal access to broadband. Period. This is not negotiable. This isn't something that should be privatized. It shouldn't be a for-profit thing. This is a reality, okay? Is people need to have equal access to information. That's the key to having more transparency. One of the things I propose is actually an app that would be dependent on having everybody have broadband access. An app, a unified app for your smartphone that actually lets people access government services, that lets them know how their money is being spent on a day-to-day basis, that lets them know when there's public meetings in their areas that they should attend or issues that are going on. It increases transparency to be able to do those things. And we have an Office of Technology and Information Services that could develop this app in a matter of weeks and put it on everybody's smartphone. But in order to do that, we have to have the technology in place for people to use it. All right. And that's key. Broadband access is so important. We learned this during the pandemic when we had entire communities where they had to open their parking lots for their family, people to drive to with their kids and sit in the parking lot so they could do their lessons. That's just wrong. We should have a cheap, affordable, subsidized broadband access throughout the entire state that's equally available to everybody. But because we've let the private sector determine how they're going to do that, they're only doing it where they can make a large profit.
Speaking of profits, I know Governor McMaster has raised $3.5 million for his re-election bid. He also had millions more cash on hand, I believe $2.5 million.
Yep.
When will you release your fundraising numbers, and how do you plan to compete against the governor in the cash race?
I don't. He can spend all that money. I'm fine with that. My goal is not the same as a traditional politician because I'm not a traditional politician. I'm not a centrist Democrat. I'm not a lawyer. I'm not a career politician. I have no intention of trying to get reelected if I'm elected as governor. I want to serve for 4 years and then step down and let somebody else who's qualified, equally qualified, take over what I've built on and build on what I've done. I haven't tried to raise millions of dollars. I think that one of the problems we've seen in the past, especially in the Senate races a year or two ago, was hundreds of millions of dollars literally being spent that didn't change people's opinions. I could run all the TV ads in the world, but Democrats are going to tend to vote for a Democrat. Republicans are going to tend to vote for a Republican. We're not really going to change each other's minds that much in this state. My goal is very different. Last year alone, 1 million registered voters in our state didn't vote. Why? And I've spent a lot of time talking to people that didn't vote. And it's because they feel disenfranchised. They feel disillusioned. They feel the government doesn't work for them. This is something I'm very passionate about, is that I feel like the best chance we have of winning isn't in a cash spending race or a fundraising race. It's reaching those millions of people with a message. And that message is very simple. If you hope for a better future for South Carolina, come and vote for me. That doesn't mean I have to spend millions of dollars running TV ads, attacking Governor McMaster or attacking other Dems in the primary. It means I have to reach those voters. That can be done cheaply, significantly, just like we're doing right now, by talking about the issues, educating people about the issues, and giving them an alternative. In an ideal world, I would probably be running as an independent. I'm just being honest. But this isn't an ideal world. Running as an independent is a lot of work. It's an insurmountable amount of work in this state. You have to collect literally tens of thousands of signatures just to get on the ballot. But I'm a Democrat at heart, all right? I'm not your traditional Democrat. I'm not a centrist. I believe in progressive issues, and I'm going to fight for those issues if I'm elected. And I want to reach that million people who don't vote. They're not going to pay attention to attack ads from the Democratic contender versus the Republican contender. They're going to pay attention to the messaging of the people running for office. And my goal is to reach them, get them to come and vote for me in June. And then win or lose, hopefully they'll be back in November to vote for whoever wins our primary. That's my entire campaign strategy.
And I hope to get State Senator Mia McLeod on Quintin's close-ups. I've sent her an email as well, and I hope to have Congressman Joe Cunningham on back, and I hope to have you back as well. Gary Votour, thank you so much. And thank you for your time here on Quintin's close-ups. I truly appreciate it.
Same here. I love you. I think you're doing a great job, and just keep up the good work, and I look forward to talking with you again.
Thank you so much. I appreciate it greatly.